I'm Jennifer Gilmour, and I'm an author and advocate for women in abusive relationships. I want to get to the answers to the questions that many have from those that work in the domestic abuse sector, getting an inside feel of what it's really like in their job role and sharing it with all of you. And welcome to the next episode of the Abuse Talk podcast. I am so delighted today because even though we've got Michelle PEGS in the corner, it is Michelle John, isn't it, Michelle?
It is. Apologies, I'm still learning my technology. Never mind.
Oh, well, we're here on YouTube. If you're watching live, hello. If you're hearing us on the podcast, then that's also great. And I'm really looking forward to this discussion and conversation with Michelle because it's something we haven't covered on the podcast before. And I actually was just saying, why not? You know, what's the problem with this? Well, in fact, it's hidden. And so I'm really glad to be opening it up for discussion today. And I'm really looking forward to getting to the subject. So what is it? We're going to be talking about child to parent abuse, which kind of sounds a bit daunting, but I'm sure Michelle is going to help us along our way to having an understanding of this. So before we get into all of these questions, Michelle, can you just tell us a bit about you and your background and what's led you to this, journey with PEGS?
Yeah, of course. Thanks for having me on, Jennifer. I've been excited to come and share what we do with all of you. So my background is in domestic abuse and family law, and then in 2019 through failings and missed opportunities of services where I and my family were failed basically at a horrific rate. I decided to turn my pain into power to empower others, and PEGS was born. And so, November 2019, officially we were created and we went operational in April 2020. And whilst I'm quite open about lived experience, I don't talk about specifics because my child's my child. But yeah, so that's where we were born from, and we've grown at an incredible rate, which is brilliant, but also incredibly sad.
Yes, I mean, I was going to talk about, the difficult side of things, how that comes across. But before we get into that part, then, Michelle, can you just tell us what PEGS stands for?
Oh, it's a mouthful. Parental Education Growth Support. It's a really big mouthful, apologies, but in short, PEGS helping parents hold things together. Cheesy but effective, Jennifer, that's what we all like. And what I wanted to do was make sure that it was clear that we are there for parent carers and guardians, that we do offer that support. And it's also about educating. And then I thought, actually, I've really got a word here. So that's where PEGS came from. I'd like to say it's more interesting than that, but it's not.
It's nice and easy to remember, so that's a good start. So thank you for that, Michelle. Now I was saying about it being hidden, it being you were saying that to me, and I thought, why haven't we had this discussion over child to parent abuse? So obviously I'm a mum of 3. It's really hard for me to think of being in that situation and trying to understand how that situation can come about. So can you let us know a bit about what it is like to be in that family situation, and what age are we talking about here? When we talk about child, I'm thinking, anywhere from 5, and you think of someone really innocent, don't you, when you think of the word child? So what age are we talking about as well?
Good question. So we call it child to parent abuse. Because you never stop being a parent, your child never stops being your child. So we support parents where their children are sadly as young as 5, and also parents where their children are actually adults. It's important that we talk about it. It's extremely uncomfortable, and I understand how uncomfortable it can make some people feel, but it is the reality of so many. So 1 in 10 families will experience child to parent abuse, which equates to around 3% of the UK population.
And that statistic shocks me because I'm assuming we should have more support out there. That's my initial thought process there. Now, you said as young as 5. Can you give us an idea of what this looks like?
It can look like lots of different things for lots of different families. What we're finding as an organisation is that there's similarities, but they're all different and individual to that family's need. So not too dissimilar to intimate partner domestic abuse, we are seeing cases where parents are being physically abused. we are seeing cases of 87% of the families that we support are experiencing, for example, being controlled. They're being physically attacked and threatened, and their homes are being destroyed. We also know that 76% of these families are being verbally abused on a daily basis. And this statistic shocks me, and it comes with a trigger warning, because I was challenged by my own organisation to include it when I was asking parents what were their experiences. Just under 5% of the families we support are experiencing sexual abuse from their own child, yet we're not talking about it because it's incredibly uncomfortable.
Well, yeah, I mean, I feel uncomfortable even, thinking about it and hearing that statistic. I guess it's something we don't want to think about. When you become a parent, you are thinking about all of the nice experiences that you're going to have and how your family life is going to unfold, and you have aspirations for your own children, don't you? Never mind yourself. So I mean, you've kind of said that, and I'm trying to sort of bring this into perspective and think about, goodness, there are people down my street, there are people I know that could be going through this. So I know you said about as early as 5. So I'm guessing that there could be some kind of prevention work there, but that's my assumption. So do you think there could be something that, would help people, if the signs were spotted, would there be work for prevention there to be able to, support that family so that child, I can't get my words out here. Does that make sense? Can it be prevented? 100%. Is there a right time? Is that with the right support at the right time, can something be done about it?
Of course. This is the biggest barrier for parents. They're not being believed. Society also tells us that we have to be this perfect parent. Asking for help and support as a parent sometimes can make parents feel shame. We feel as though perhaps, what are we doing wrong? What is wrong with my parenting? When we reach out, or when these parents and the parents that we support are reaching out, they're reaching out at crisis point. But when you unpick it, they've been asking for help and support for years. Some of the families we support over a decade, they've been asking for help, all whilst they've been told it's your parenting, go on a parenting programme. We wouldn't send an intimate partner victim of domestic abuse on a programme on how to be a better partner, but it seems to be okay that we send parents on parenting programmes. I'm very clear, I'm not saying parenting programmes don't have their space, because of course they do, but not where child to parent abuse is being displayed or occurred or suspected within the family home. Parents aren't being listened to. It's seen as though it's typical behaviours. We've identified a 7-stage cycle that parents across the UK are going through, and they're still not necessarily getting that help and support at the end. It is absolutely appalling. What we need to see change is policy and procedures and frameworks for practitioners, because a lot of practitioners that are aware of these behaviours, they haven't got a lot, but they're stuck. They can't go anywhere because their own services or organisation or the law, the policies, whatever, are not in place. So if we can upskill people, we can upskill them, that's fine. But if they haven't got a framework to work from, then actually what we're doing is frustrating that professional, and we're leaving families at risk and at crisis. We're suggesting, because we've created an identification model that is currently run out over 4 local authorities, 2 health boards, the whole of the Powers Police and other areas in England, and potentially in Scotland we're looking as well. We're really fortunate, Jennifer, to have this opportunity that identifies quite clearly whether or not the behaviours are abusive. And then that forms part of a response needed, which currently the government recommendation is a safeguarding response, and that's one that we support. That's not saying that families need a social worker, it's just saying that a safeguarding response needs to be considered. And we're saying, by having these assessment frameworks in place, these policies, by listening to that parent, the parent's the expert. I'm not the expert, no more than anybody else. We are all experts in our own family situation. And one of the most powerful things I ever heard from one of my parents tell another parent was, trust your own parenting. And I think that is so powerful.
It's almost like, trust your own when it comes to health, your body, you do know your parenting, when there's something wrong with your child, or that, something needs to change. So where would families typically go initially for some support, where they're not receiving the right direction, perhaps? Education.
our parents are saying their first port of call is schools, colleges, followed by health. So you're looking at GPs and CAMS. I'll also quickly talk about another service in a second. But yeah, so we're saying let's upskill teachers, pastorals, safeguarding leads to ask those questions, because quite often parents are told our child's fine in school, but actually what does fine look like? And just because they're not displaying that behaviour at that time in that environment doesn't mean it's not being displayed elsewhere. We would never question an intimate partner victim of domestic abuse, for example, about that, but we automatically question, well, they're not behaving like that here, it must be parenting, there's something going on in the home environment. And I'm not saying that isn't always the case. We do know that obviously for some families there are things going on. But there's also a tier above CAMS called forensic CAMS, and they're a statutory service. There's 13 forensic CAMS across the whole of the UK, and they offer recommendations and consultations to professionals who are working with families who have a child up until the age of 18 with or without a diagnosis, who are displaying harmful, aggressive, violent behaviours towards themselves or at risk to themselves or others within the home. But very few services and people know about forensic CAMS. Forensic CAMS don't case manage, they don't, but that just means that there needs to be health, education, social care involved in order to case manage. And quite a lot of the families that we support sit under that forensic CAMS umbrella, and they're a really good service. They offer, they're made up of clinical psychologists, psychiatrists, social workers. I talk about them all day long, and that's mainly because I've got a clinical lead that sits on my board, Jennifer, so I'm a little bit biased, but their input is invaluable. And I think that the more we talk about these services as well, the more help we can give practitioners and these families. So where we're having families come back through saying, beg your pardon, CAMS can't pick the referral up, it's not mental health, it's behaviour, it's nothing to do with us, and all these things which families are hearing on a daily basis, what should be considered actually, do we need to refer this up to forensic CAMS and have that consultation? And so I think sharing, I'm quite proactive as an organisation, I like to think, and I'd like to share information. I think no one knows everything. I'm not Google, no more than what you are, but I think we need to work together. I think that we need to have that connections as services and as communities in order for everybody in the community to live fear-free and safe. And that is the ultimate goal. Families don't not want their child, they don't want the behaviour, which is completely different. And I think that's why when you hear, certainly me and my service, when we talk about the behaviour the child or young person displays, we don't call them perpetrators. It's not helpful, it doesn't help anyone, and actually it's somebody's child that we're talking about. And parents feel, by the time they come to us, a lot of them feel that shame, they feel embarrassed, and also they feel betrayal because they're telling on their child, one for a better phrase.
I mean, it sounds I'm trying to put myself in that situation as a mum and how I would feel. And, the first thing I think, failure, because I need to get that help and support. And I'm happy to share that there was a moment when my eldest was showing OCD tendencies. And if things didn't go the right way, there was one time she threw a chair down the stairs at us. And she threw things at us, and we were really worried. Thankfully, we were able to get some really good support at the school. But I have to say, we had a referral to CAMS, and it took a year for us to actually have a phone conversation. I have heard from many parents about the bad reputation CAMS have got. So can you give us some reassurance about CAMS in general, or perhaps the forensic side of things, which I have never heard of and perhaps might have helped me in my situation back then?
Yeah, I mean, I'm a third sector. As much as I would like to say that I can make everything okay with the world, we can't. That's the reality. I need to be very clear. CAMS have their place. I understand and I hear daily the frustration from parents, I really do, but to be fair to those practitioners in CAMS, they're in it because they love what they do, but they're also restricted, aren't they, by what their criteria are and everything. And I get that they're frustrated too, and I'm not anti any service, I'm really not. So I'm not going to sit here and go, let's all shout about CAMS, because that's not actually what I see at that point. Is there needs to be more investment into CAMS, there needs to be more staff, there needs to be more funding. That's something that mean you've got no say in at all. In terms of forensic cams, I just have a lot more to do with forensic cams based on the families that we support. And obviously, because I've got one on the board, so I do know quite a lot about. I'm quite biased. I am quite biased, but they are a really good organisation, and their skills are amazing. But I also hear on a daily basis from families how frustrated and disappointed they are that they're not being listened to, and everything that the parent discloses is always around the child in terms of, but I just need to identify what's going on for them. I want them to have the right help and support. When they come to us, we do listen to all of that, but part of what we do is put them at the centre, and they struggle sometimes because we're like, okay, but how are you? How do you feel? What do you want for you? And that can be overwhelming, because when you're a parent, your focus is your children. Whether you've got one child or multiple, it makes no difference. Your focus is your own person. And so a lot of these behaviours, it hasn't just happened overnight, it's happened over a progressively long period of time that have escalated. Not too dissimilar to intimate partner domestic abuse. No one's woke up one day and gone, oh, my child's now decided to behave this way. But what's happening is, because families aren't being identified at the earliest of opportunities, because there's not those resources there, because there's lack of policy, there's lack of training, lack of knowledge, it's a barrier. And that's not okay. Change only happens when we do something different. How many times are we hearing lessons have been learned, yet the same mistakes, one for a better phrase, keep being remade? That then makes that lesson not learn. It makes it a choice that actually we've learned better, but we're still going to do the thing that we're doing. We haven't learned and improved practice, or we haven't learned and improved different services available. And I know from a political point of view, that's nothing to do with us. It's all to do with different things. But it also factors down, you know, the people that our families are trying to reach out to, want help and support, want to help these families, but they're just stuck too. But that doesn't help my family when I've got a parent ringing the phone saying my child's just tried to stab me, and I've just been told, take the knife off them and stop ringing me.
Just going to say about I'm putting myself back in that situation with my own daughter, and if things had have gotten worse, who am I calling? Who am I wouldn't call the police on her because she's a child. Who am I getting help from? Who am I protecting myself? Where do I reach out? So could you tell us what should we do if there's somebody out there that's feeling at that point of needing support?
As much as I heard you just say that I wouldn't ring the police, for some families the police is the only option that they have because of safety. We always say safety first. Always, if anyone's at risk of harm, then part of our response is actually you need the police, just to make sure that you're all safe. In terms of if this behaviour is going on in the home and you're not quite sure what's going on, something is a little bit maybe it's not at the level where it's abusive behaviours, but you're not quite sure, you do have the options to talk to school, the GP. You can always ask for a second opinion. Early help provision. I know a lot of people have fear around social care, but social care have a massive umbrella, and depending where you are in the country does depend what early help is called, if that makes sense. They're the lower tier, but you can access all of that. There's things that can help you. So, for example, if you have a child with a diagnosis under the age of 16, legally parents are entitled to a parent carer assessment to assess their needs. There's forensic cams, like I've already spoke about. There is other things that you can look for locally, whether that is domestic abuse organisations, whether it is talking to the police about the community support that they could perhaps offer, looking at the school and education and saying, okay, what provisions have you got access to that can help my child and young person? Because there are great services out there, usually third sector as well. I'm not going to say, I'm not dismissing statutory, but for example, where we're based here, we work alongside another fabulous organisation that works with the children and young people regularly, and we work with the parents. So it could be just exploring, what does that provision look like? If there's issues around school attendance, okay, is there a need for an education healthcare plan? What does that look like? So the things, for example, SENDIAS, which are in every local authority, they might be called something different, but in essence, what they do is they provide support to families to complete or apply for applications regarding education healthcare plan that then can look at that young person's needs. Now, we're quite often contacted and told by families, the school have said, well, they don't support it, I can't apply for one. A parent of their own volition can apply to the local authority for an education healthcare plan. Right. So it's things like that. Think about siblings. What's going on for siblings? Is there, if the young person displaying the behaviour isn't at the stage that they want to talk to somebody about it or look at their behaviour, perhaps siblings need support. Consider whether there's been a bereavement or a loss within the family. So 50% of the families we support have experienced loss or bereavement, significant at some point in that child's life. Okay, let's look at, what does that look like for that young person? Has anybody spoke to them about what that bereavement or loss is? And that doesn't necessarily mean that somebody has to die when we're talking about a loss. It can be a change of school and they've missed a teacher, friends. Loss isn't a pet, lots of things. And there's things just, okay, what is going on for my family? If parents have to sit and map that out as a mind map, what am I worried about? What's working well? What's not working well? And what would I like for my future? That's great, because that gives them a plan to work towards, and share that with professionals. It's really frustrating sometimes for parents, and it's really exhausting because they're constantly banging the same drum, just on a different door, and sometimes that door keeps getting shut, Jennifer, which is really sad.
Yeah, I mean, it sounds great when you know you've come on here and you've told us all these links to support that probably we had no idea about. And often what I have seen is within different support services is there might be 2 or 3 people involved, or 2 or 3 support services, and they're great individually, but collectively coming together and trying to speak sometimes is uneven and difficult. But again, if you're in that situation, you're going to have to persevere. So let's talk about how parents are feeling, because obviously you mentioned that it's there's shame there. I mentioned I might feel that sense of failure. I'm hearing kind of desperation from you as well. Can you give us a picture of your general families feel when they come to you? How are they in their mental state?
It does vary depending on, because we've all got different resilience. I know resilience as a struggle word for some, but we do have different coping mechanisms. One thing that is clear, every parent that myself or my team have spoke with, all the parents have said that they feel isolated and alone, and that's even if they've got really good support. They feel shamed, they feel that they're at blame, at fault, and they are desperate.
So you are there. PEGS is there to help and support. So let's talk about how you can help families, and also could you let us know if you're a region specific? I know you're based in Shropshire, if I'm correct, but can you help people that are in other areas of the country as well?
Yeah, we do. So when we started in March, April last year, I wasn't sure what PEGS was going to be. I just knew that I needed to try and make a difference to somebody. By April of this year, we have supported by July this year, 1,445 parents, which is a really large amount of parents. And we've done that in various ways. All our parents that come to us, any parent, care or guardian can access our drop-ins, our free drop-in virtual. So we've expanded from Shropshire to nationwide now. And that's because of the limited support available out there. So we've got weekly drop-ins, and they're about to increase to, well, by the time this goes out, it will be twice weekly now. We've got a morning session and an evening session. Details will be on our Facebook page and also on the website. To parents, I'm very clear they're support programs and they're not parenting programs. So EPIC, which stands for Empowering Parents in Crisis, one of my parents came up with that name, and it's amazing. It's an 8-week program, and it focuses on parents' well-being. We talk about behaviours, we talk about self-advocacy, we look at trauma responses as well, which is really important for them as parents, and then as their child, we get explore love language, what that looks like, why does it matter? And then we've also got other programs like Bounce Back, Step Forward, which is a self-confidence resilience program that's been created by a lovely friend of mine. She's amazing. She is really good. I'm really fortunate to know her. And so we've run programs like that. We have got advocacy support going on for parents. So if they need some help talking to professionals, we can come in and give a chat, or at least ask for a professional meeting. We do risk assessments and home risk safety planning for parents. Every parent that comes to us will get offered an initial consultation with one of us if they want it. And then they also then get completed home risk assessment, safety planning. They get access to peer support group that's closed as well, so parents can access that. We're trying to really make sure that we're meeting the demands. What I can also share is because 60% of the families we support have said that their employment's been affected, they've had to leave employment or have considerably reduced hours. The Department of Work and Pensions has partnered with us on a national scale, and we've created the Child to Parent Abuse Covenant that employers can sign up to get help and support and policy in place to help any employee.
Right, that's amazing. That's massive. I mean, I hadn't even considered employment. I hadn't even considered the impact on employment and why, you know, it would do, wouldn't it? Especially, I'm trying to think of all the different situations here. So congratulations on that. It sounds like you're really making a massive difference, and I know there'll be people that will be resonating with some of the things that you've spoken about today. Can you tell us, how do we find you then? Obviously, we know you're based in Shropshire, but how do we find your Facebook support group? How do we find everything?
So you can find us at www.pegsupport.co.uk. You can find us on all the social media channels. Facebook, you can find us at PEGS, Child to Parent Abuse. You'll need to contact the page in order to have access to the peer support group, because it is closed. Unless you spoke to one of us, we won't let you in. That's not us being rude, it's just that we need to make sure safety. And then we've also got other social media that's posted on our Facebook. I would like to give them to you, but I'm not going to lie, I don't know them. That's great, isn't it? It's because I don't access the social media platform, Jennifer. I have somebody else that can do that now. So I'm well prepared on that. But yeah,
well, what we'll do is I'll pop it in the I'll pop everything in the information. So if anyone's tuning in, check out the description. I'll pop all the links there so everyone can find everything.
No, thank you so much. I mean, we have grown. We've also, as of the Domestic Abuse Act got passed earlier this year, and I was the only organisation that gave advice and guidance to the government on the child to parent abuse. All 11 points have made it into statutory guidance, and that's due to hopefully after September the 14th. That will now turn into the final guidance for the bill, or for the act, sorry, which is incredible, because that now means that there's going to be legal obligations there for services to respond in an effective way, which can only benefit the families that need this.
Yeah, I think it's really difficult when we think of the words domestic abuse. Ultimately, we think about relationships, but it's not just about those romantic relationships. And then even when we think about it further and we think of families, we think of sibling to sibling. Do we ever think about the child to parent? So I think what you're doing is absolutely fantastic. It's clearly needed, which is really upsetting to hear, obviously, but thankfully you've just given us like half an hour of fantastic resources and information that we can all go away with and look up on research further. So that leaves me to say a massive thank you, Michelle, for joining us and for sharing a bit about your journey to PEGS and it opening up wide to not just Shropshire but nationally, and obviously the difference that you're making to those families and nationwide in terms of the DA bill. So thank you so much, and I'm sure we will be in touch in the near future. Maybe there's another subject we need to cover within this. I think there's definitely more for us to talk about.
Thank you for having me on, Jennifer. I'd be delighted to come back and talk some more.